All right. Hey, everybody. Welcome back. Two quick things to get out before we start. One is if I look a bit skinnier, that's because I was quite sick in the last week and I lost a few kilos. And, thanks to everybody who, gave me a lot of support. I appreciate that. I just got that body type where, if I don't eat for a week, I lose a bunch of kilos and then it's going to take me an entire year working my ass off to get it back. A lot of people say they want that kind of metabolism. Trust me, you don't. It's very annoying. And the other thing, if my eyes look kind of puffy or weird, that's because I had laser surgery 2 days ago. So I didn't get into any fights or anything like that. I just had, surgery, so I don't need any glasses. I'm not wearing contacts right now. So that is awesome. I'll have a video coming out on that later, but if my eyes look a bit weird, that's why. Last year, I did an epidemiological study with my father on drowning deaths in Taiwan. And what we found, number one, is that there's a major disconnect between sort of the nature of drowning and also public perception. And the reason that's important is because, public perception is also what drives public policy. So unless legislators have, seen my video on the topic, which, there's a link here, and seen that study, then they're going to be modeling their water safety legislation off of bad assumptions. And, bad assumptions are going to have bad outcomes. And, we care a lot about the safety of water sports and we want to reduce the drowning levels. So, in a perfect world, all of that legislation would be, not based off of assumptions, but based off of data. And the other thing we found is that drowning rates have decreased dramatically. And this is quite amazing. And, try to put this in numbers to sort of state the impact on this. So in the late 1980s, the drowning rate was relatively stable at around 1,500 drownings per year, drowning deaths, right? And now, it's been very stable over the last 6 years at around 300 drowning deaths per year. So, there's 1,200 less people that died every year compared to the 1980s. And, if we look at the range in the past 30 years, we see this sharp decline in drowning deaths. And it's about 15,000 people, 15,000 less drowning deaths than you would expect. And around 6,000 less drowning deaths just in the last 5 years. So there's a huge number of people in Taiwan who are not dying of drowning compared to what we would expect had those rates not fallen. So this brings up a really important question, which is what reduced the drowning death rate in Taiwan? The reason that question is important is because if we know what reduced the deaths, then we can reduce it even further. The target here would be 0. 0 is an unrealistic figure, but we want to be as close to 0 as we can. The average drowning deaths in Taiwan would be around 0. At the end of the last study, I didn't know what was the cause of the reduce in drowning deaths, and I sort of falsely attributed it to increased swimming rates in Taiwan. I said, okay, it's a great public health achievement. Probably the Department of Health and Education, has a big role to play in this for reducing the drowning rate. But something always bothered me about that remark because one is that the most of the drowning occurs in elderly people. So, we're talking around, people 50, 60, 70. Like, this is where the majority of drowning deaths are occurring. And, it's especially even people 70, 85, the highest rate of drownings in people who are 85 years old. So this is not consistent with reforms in, childhood education programs for swimming. So it doesn't actually makes sense that increased prevalence in swimming or increased interest in water sports would really have an effect on the drowning rates. So, I pored over this data and using the NFA data, I was also able to model it. So I was able to graph this data on a map, and we can look at where drowning deaths are occurring, and hopefully from that information we can infer perhaps what's the cause of drowning deaths. So I took a deeper look in the data, and I looked at the mapping data, and what I found is that I think my initial gut reaction was wrong. I don't think it has anything to do with swimming at all. And also, the education department, sorry, I'm going to have to take this success away from you. I think that the majority of the decline in drowning rates, it has to do with policies and work done by the Water Resources Agency and also city governments. You see, there's kind of this instinctual assumption made whenever we're talking about drowning deaths that we are talking about, somebody going out to the beach or the river, waterfall, whatever. They're, going out, they're swimming, they're surfing, they're jumping off rocks and stuff like that, and then an accident happens and they drown. But actually looking at the data and looking deeper into it, it's about, 90% of all the drowning deaths don't fit into that category. What it seems like is that almost all of the drowning deaths occur in urban settings and likely fit into only two categories. One is suicide. We cannot talk about drowning deaths without talking about suicide because between 50 and 75% of all drowning deaths are suicides, and the other 50 to 25% is slipping and falling into water. So this we call unintentional submersion. So we can basically categorize everything into intentional submersion, which is suicide, and unintentional submersion, which is slipping and falling in the water. And these kind of mountain setting, jump in the river, lake, ocean, swimming, this kind of drowning deaths where it's like an accident during water recreation. It does happen. I think it happens in the order of around 20 to 30 times a year on average. So we're talking about 10% of unintentional drownings. But it's really, in terms of the data, it actually just makes a very, very small impact. So even if we reduce that by half, which is an important thing to do, in terms of the overall data, it wouldn't have that much of an effect. So let's take a look at this data and what I found. So here's a map of all of the drowning deaths that occurred in Taiwan, and I'm also going to link that down in the bottom so you can take a look at it yourself. And it's important to note here that about 250 or about 10% of the data points were not able to graph due to just address errors, and also any data points that would be the ocean further than 1 kilometer from shore, or boat accidents are also not able to graph here, just because of mapping limitations. But the majority, around 90% of all of the drownings, we were able to put on this map. And this data comes from the National Fire Agency, and that includes all drownings that they were involved in, so that's all suicides as well as unintentional drownings. But it doesn't include drownings that the fire department was not involved in. So it doesn't include drownings, in say public pools, bathtubs, in people's houses, that kind of thing. However, let's take a look at the data. And so immediately, you can see if you graph it, onto like a population map of Taiwan, you can see this is overwhelmingly in the population centers, and we zoom in, we can see that quite a lot of it's happening in Taipei. And unfortunately, I wasn't able to group this data into clusters, so if there are multiple drownings at a single location, they're all going to stack on top of each other, and you won't be able to really see it here. So, for example, if you go to a city park and you start separating things out, you can see that there's more than one drowning just in this location. But if you zoom out, it's only going to look like one point. And so as we go through these maps and look at these different places, what we can see is that the drowning deaths almost overwhelmingly happen in places like drainage ditches. These are places where people are going to fish, dump things, or wash their fertilizer bags. It's also places where people are just walking along the road. There's always a path or a small road along these ditches and these canals, and it's an easy place for somebody to slip and fall and end in the water. And this is also kind of supported by just the age range at which most deaths happen for drowning. So the reason I said we can't talk about drowning deaths without talking about suicide is because there's actually about 600 drowning deaths that happen a year, and 300 of those are confirmed suicides, 150 of those are confirmed accidents, and then there's another 150 which are unknown. These are kind of floating body situations. Person was alone when they drowned, nobody saw them, and so we don't know what happened to that body. And this represents about 25% of all drownings and about 50% of listed unintentional drownings. So we don't know what happened to these people. We know that some of them are probably suicides and some of them are probably accidents. However, the accidents only number 150. So, if we were to put all of these into accidents, it would increase the known accidental drownings by 100%. Well, if we move this into suicide, where there's about 3,500 suicides a year, then, it only increases the suicide rate by about 5%. So just in terms of like statistical likelihood, there's a higher probability that most of these unknown drownings are unknown suicides as opposed to unknown accidents. And so like in the last video, I talked about kind of at the end, say that, like the real public health crisis here in Taiwan is suicide rate. And so if we want to reduce the sudden unexpected death rate, accidents and suicides among people, particularly young people, really we should be focusing on ways to reduce the suicide rate. But I didn't, come here to talk about suicide today. We're talking about drownings. So let's kind of go into this data a bit and take a look about where the drownings are and see if there's something we can learn about these drownings to see, okay, how was the drowning rate reduced in the first place and what can we do to further reduce it in the future? And so what we can see from this data is that it's overwhelmingly happening in urban centers and along these kind of like small canals, small rivers. This is places where people are going to, previously probably to wash their clothes and their fertilizer bags. Now it's much more likely they're just, walking along these paths or they're fishing and they're accidentally slipping and falling in. It rains a lot in Taiwan. Things get slippery very easily in Taiwan, and it's quite a common thing to happen, to slip and fall, particularly for elderly people who make up the majority of slip and fall deaths, but also drowning deaths. So I think there's kind of an overlap between accidental fall and accidental drowning. If there's a fatal slip and fall accident where a person succumbs to an injury, that's going to go to slip and fall deaths. But if there's a fatal slip and fall where they fall into a body of water and end up asphyxiating, then that's going to be a drowning death. But it's not such a clear distinction between what happened, especially if there's nobody around to see it. So as we look through this data, we notice there's more and more and more in urban centers and along these small waterways. What I think happened is that over the course of the last 30 years, the cities in Taiwan, the urban governments, and the Water Resources Agency have built up the waterways to make them more safe. And what that means is that they have put in flood control systems that prevent the waters from leaving the canals and going up and sweeping people away and flooding urban areas, and also that they've been putting up a lot of barriers around the waterways and around places where people could accidentally slip and fall in, and just have reduced the amount of accidents by making it less likely for somebody to fall in. And really that is what I think that happened, which caused the reduction in about 15,000 deaths over the last 30 years, in that there have been active and guided programs to try to reduce deaths from accidents. And I've gone out and I've talked to people in the Water Resources Agency, and I've talked to people in the government, and what I found is that sort of for the people who are in charge of water safety, is they don't care about sports. They don't care about water sports. They're not river tracing people. They're not, into swimming. They're not interested in going out and playing in the water, and they don't really see regulating water sports as their job. Actually, what they are is they're engineers and hydrologists and scientists, and so they're focusing on how to prevent landslides and floods and how to divert water through cities and urban centers, population centers, and they're focused on providing water to the farms and the factories and the water treatment plants and managing the reservoirs, and actually giving them this purview of also having to manage water sports is kind of a disservice to them because it's not really their business. It's not really related to anything they're due. Like people going out in the rivers and the mountains and, maybe getting in an accident, or people swimming and fishing and maybe getting in an accident. That's very hard for them to control because this is sort of like what people are actively doing and actively choosing to do. And it's just not their business. Like it's not their business. And when you look at the maps of where cities have blocked places for swimming, a lot of it just doesn't make sense, and also doesn't match up with where accidents are occurring. So in the previous video where I talked about this sort of nonsense system of blocking areas, where I mentioned actually the Taiwan city government, they have blocked all of these water outlet. I don't think are particularly dangerous, but it's where the roads meet. So it's where a person could go down if they wanted to. And so here you can see those like 5 or 6 rivers. Each one of them is banned for water access. But we can't. There's no accidents that have occurred there over the last 5 years. We can't find any data to show that there's accidents there, and so there's a really weak argument to be made. Oh, because it's banned, there's no accidents. But let's face it, Taiwanese people, don't really care about these bans. These bans do affect legitimate business, so it affects like tourism, but it doesn't affect people just going out and swimming and fishing. People don't care about it, and also people don't know about it. We have to dig deep to find actually this legislation to show it was there. There's no signs that say that that area is banned. It's only deep down in the legislation. So I don't think that it's a rational argument to say that there is a causal relationship between the ban and the lack of deaths. I think that it's just, I just think that there's no relationship at all between recreational sports accidents and bans on recreational sport. I think that it needs to be entirely rethought out, especially since it seems like recreational sports only make up about 10% of drowning deaths. When we look at where recreational sports and tourism drownings occur, those areas don't even have bans on them. So we're talking about places like, Sun Moon Lake, which is actually, open for recreational tourism, but it does have quite a few drownings that have happened there in the last few years. Ching'un's waterfall, one of my favorite waterfalls, unfortunately, has also had a lot of drownings over the years. And, you can also kind of see them scattered in various places in the mountains. But overwhelmingly, it's kind of unrelated to where the majority of drowning deaths occur, urban centers, and also where recreational accidents occur as well. So what can we make of all of this information, right? So I've gone on for quite some time now, but what can we make? Because ultimately we want 2 outcomes, right? We want 2 outcomes from the study of how accidents occur. So the first outcome we want is to reduce accidents. So we want to reduce the drowning deaths. I think, my recommendation on that would be to study this map, look at where the drowning deaths are occurring, and to implement construction projects in those areas that can reduce the drowning deaths. And I'm not talking about signs that say, hey, this is dangerous, don't swim, or something like that. Those are not effective. I'm talking about putting up railings, putting up places, people can hold the handrail, things like that, so that people don't slip and fall in. And if it's a recreational place like a park where people are fishing, maybe build some platforms where people can fish from instead of, having to stand in slippery and dangerous areas. And if it's a park where people are actually doing recreation, then provide life jackets. It's very simple. These are urban centers with a lot of population, put up a life jacket sign where people can take and remove life jackets, and also swimming rings that people can throw. That's my first recommendation for how to reduce the drowning deaths. I think that would be a pretty low-cost, high-reward program to implement, and it can be done all over Taiwan. The next thing I would recommend is a bit unrelated, but it's always it's mental health related, and this would come at a very high cost, but also with a huge benefit to society, is to perhaps rethink the policy of excluding mental health from national health services. Mental health is health. We know now, like unequivocally, the data is in that the mind and body are not inseparable entities, right? Your mind and body are quite related. I mean, we're talking about just things like the placebo or the nocebo effect, where we can see health effects of just the way people think. These are measurable in a lab, and so there is also something to be said for depression and other mental health issues, which is that those are part of the health system of a human. The mental health is also part of health. That's a major undertaking. It has much more far-reaching effects than just drowning, but also, it's not going to be as simple as just the previous thing I said, where just build some fences. My third recommendation is to basically remove all of these bans related to Article 36 and to water tourism, because it doesn't really relate to any of the drowning deaths. It's such a small percentage, about 10% of the drowning deaths. For that, okay, for those interested, that would be up to like 32 drowning deaths a year. And put more pressure on industry to regulate safety. And so what that means is that basically remove water sports from the purview of the Water Resources Agency, because one is they don't want to deal with it, and another is they don't know how to deal with it, right? There's no water sports department in the Water Resources Agency, right? They're not that. They're engineers, they're scientists, they're focused on these really big picture, big ticket items, like making sure your neighborhood doesn't get washed away in a typhoon, and making sure that when you turn on the tap, water comes out. So don't give them the added pressure and responsibility of making it so that, if somebody has an accident at a hot spring, it's their problem. They don't want this problem. They're not going to deal with it. The only way they're ever going to respond to this issue is by closing it, because it's an easy thing to do that removes them of liability. Like, it's a disservice to them, right? It's a disservice to them, and has a negative outcome on sort of the population. So just take water sports away from the Water Resources Agency and move it to the sports department. Right? There is a agency of sports, give them an agency of marine sports. There's kind of some overlap with the tourism department, which has some, also some conflict there. But put sports in the sports departments. They're the ones who knows how to deal with it, right? And instead of banning it, put the regulation on it. What that means is work with the associations, work with the tourism companies, work with the tour operators to improve safety. That means provide classes. That means outline a framework of, standard equipment, standard practice, like standard insurance requirements, standard SOPs for different events, especially for operators that are taking clients, because of the 10% of recreational accidents that happen a year, a lot of those are tours, right? A lot of those are for-profit entities, and so that needs to be managed. I'm not calling for no management. What I'm calling for is sensible management. So the beginning of sensible management is basically providing people with the tools and resources they need to go out and do things safe. The other part of sensible management is to allow people to go out and do things safely or unsafely. And the reason I say that is because if somebody's choosing to do these activities, we have to recognize that there is risk in these activities, and so it's going to be hard to get zero accidents. But what we should be doing is learning from these accidents, making them public, doing analysis after accidents, and trying to just improve health and safety of industry. And lastly, which is also unrelated, but it just goes without saying, is that resources should be devoted in the educational departments to increasing the availability of water sports and water access to children, especially at a young age, because it's very easy for children to learn how to swim at a young age. It's very hard for adults. And if you can learn to swim at a young age, that stays with you for life, and that will reduce your likelihood of an accident, but also, maybe more importantly, it will just open up the world of water sports and hobbies and jobs and just new opportunities, not just in Taiwan, but also around the world for people if they want to travel. So I think that's important. So as always, please leave your thoughts and comments down in the description. I like to think of this as a two-way conversation. And join me next time for the next video. Thanks a lot. Have a fantastic day.